Next drugs that we're going to talk about are your cardiac glycosides. So an example or prototype of this is digoxin. So let's go back. When we talk about cardiac glycoside, this is considered a cardiotonic drug, meaning it is a positive inotrope. So as we discussed previously, inotrope talks about how hard the heart is contracting, or the heart contractility or pumping ability of the heart. So since it is considered a positive inotrope, it means that it increases the heart's contractility. Anyhow, going back, so the example of this drug is digoxin, and the therapeutic action includes it increases contractility. Again, this is a positive inotrope, and it decreases heart rate. So this is a negative chronotrope. Now, contraindications and precautions for this drug include pregnancy, because safety is not really established. So if we're not sure that it's safe, it is better not to give to the patient. Lactation, it can enter the breast milk, so this must be avoided in breastfeeding females. And this medication, it is contraindicated in cases of hypokalemia or low potassium levels, because this increases digoxin toxicity. It is also contraindicated in patients who have advanced heart failure and also have impaired kidney function, as well as cases of some cardiac dysrhythmias, including ventricular dysrhythmias, as well as second and third degree AV blocks. Side effects or adverse reactions from this drug include dysrhythmias, bradycardia or low heart rate, fatigue, vision changes, and weakness. So nursing actions, knowing what it is for and what are the potential side effects, contraindications, and so on, this includes this nursing action. So first, we need to check for the heart rate, right? Because we know that it can actually affect the heart rate. Actually, it can decrease the heart rate. Therefore, we want to check for the heart rate as well as the heart rhythm, because we know that this medication can cause some dysrhythmias. Now, we also know that this is contraindicated in patients with low potassium levels. Therefore, before giving this medication, we have to check for potassium levels. So your normal potassium level should be at around 3.5 to 5. So this is where we want the potassium level at before we give this medication. So if it's really low, again, it can increase the toxicity level of this medication. Now, we also need to check for the heart rate, and if the heart rate is less than 60, we need to hold the medication and call the provider and let them know that the patient's heart rate is currently low. And usually they will give you parameters when to give this medication. Now, we also need to evaluate or assess for signs and symptoms of toxicity. So this can include fatigue, weakness, and some GI effects. And lastly, but not the least, we have to educate our patient regarding why we're giving the medication, the potential side effects, how they should take it, and obviously, especially if they're taking it at home, what do they need to watch out for when they're taking these medications.